Then, considering everything you've mentioned, these successes recorded, do you see Nigeria achieving the SDG target in health reforms before the 2030, target?
Yes, so what I can say is that because we have been lagging for a very long time in the attainment of the SDG goals, but in the last 2 years, a lot of action has been taking place, and then in a very trajectory manner, very aggressive manner, if I may put it that way. So we are going to achieve quite a lot in terms of where we are starting from. So, for example, I would like to share it with you with concrete examples. Today, one of the areas that we score badly is maternal mortality, which Nigeria is one of those countries that have the highest, burden of maternal mortality. From the demographic health survey, the National Demographic Health Survey recently, it showed that at least more than 30, at least 33 local governments of Nigeria, 33 states in Nigeria contribute to the highest burden. So currently, under the leadership of the Ministry of Health, there is an aggressive action to ensure that we reduce maternal mortality. And actions are being taken at that level to deploy resources, to deploy human resources, to build capacities of healthcare providers. And part of what they are doing also is to provide services, free for women at that level. Emergency services, the comprehensive emergency obstetric healthcare services are also deployed at that level. So with the actions being taken, we are hopeful. As we said, Nigerians should renew their hope in this administration, and that's why we call it renewed hope. We are very hopeful that by 2027, we are going to see a drastic reduction and what I call the acceleration of reduction of maternal death in this country, as well as the death of newborns, because we are beginning to see increase in uptake of antenatal care services, increase in delivery by skilled birth attendants at our health facilities. So those are positive indicators, and those are the trends that we hope to continue to build upon. And then we are beginning to see increase in coverage of immunization activities. Nigeria is one of the countries that have launched the cervical cancer vaccines, and today we have almost 90% coverage of the target population of young girls that are being vaccinated. So so those are positive trends, and those are indicators that Nigeria is on track. In fact, we are making very, very rapid progress towards attainment of the SDG goals.
Allow me to pause you.